Edmond Dodu sharing some insights on maternal health care access. It's still news highlights right here on GBC News and on GTV. Now, even though Ghana has made tremendous strides in its antimicrobial resistance surveillance over the years, its laboratories are said to be lagging behind in the proficiency testing capabilities for bacteria. At his inaugural lecture in Accra, Professor Nicholas, a medical microbiologist at the University of Ghana Medical School, recommended that government must consolidate all donor activities executed to reduce antimicrobial resistance, expand its bacteriology capacity, and strengthen the national proficiency testing of laboratory quality systems to sustain the gains made. A report by Sarah Furi.
As an esteemed Fleming Fellow, Professor Nicholas Dayie has in the last 20 years exemplified himself in his scholarly works in antimicrobial resistance research, laboratory system strengthening, development of surveillance architecture that supports evidence-based clinical practice and informs public health decision-making. His wealth of experience more than qualified him to put Ghana's fight against antimicrobial resistance surveillance under scrutiny. At his inaugural lecture following the acquisition of professorship, Professor Dayie disclosed the alarming fact of how most of Ghana's laboratories fail to generate accurate microbiology data due to a national systemic failure. Hence, the high incidence of resistance of bacteria.
Ghana was ranked 35th in 2021 for deaths linked to antimicrobial resistance.
He also noted how the dispensing of antimicrobials at the hospitals are largely dependent on guesses in the absence of accurate diagnostics.
We may be witnessing falsehood. Falsehood not because the laboratory personnel is actually fabricating data, not because the laboratory personnel is falsifying data, but it is because the reagents, the consumables, the standards may not be available to such a person, or the person's knowledge or skill is not up to the task to get it done.
Some antimicrobials on the market have also been found to be substandard and do not contain the lethal doses to kill the bacteria. Hence, the resistance patterns, high morbidity and mortalities due to antimicrobial resistance.
Strengthening blood culture systems, respiratory diagnostics, cerebrospinal fluid analysis, and stool culture should be a national priority.
Professor Dayie made a number of recommendations to sustain the efforts towards Ghana's reversal of antimicrobial resistance.
We need to strengthen national proficiency testing and laboratory quality systems. That is my fear, because we have just tested and we realize that 4 out of 6 have not performed. Ghana must sustain AMR surveillance system beyond donor funding. Strengthen One Health integration across human, animal, plant, and environment sectors. We also need to review and develop a new national action plan for antimicrobial resistance.
Vice-Chancellor Professor Nanaba Appiah Amfo appealed to government to make deliberate efforts to upgrade Ghana's laboratory systems.
So it's important that we fix our laboratories, we invest in our laboratories as part of the attempt to strengthen our healthcare systems, invest in equipment, in reagents, in training.
Professor Dayie was presented with citations and gifts from the National Antimicrobial Resistance Platform, colleagues and family. Sarah for GBC News, University of Ghana, Accra.